Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, the Philippines confirms its first case of the novel coronavirus.
The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020. She is currently asymptomatic.
With the health department reminding the public to stay vigilant.
I believe that will still change. It could expand the number or increase the number of places.
The World Health Organization declaring it as a global health emergency.
We don't know what sort of damage this virus could do if it were to spread in a country with a weaker health system. We must act now to help countries prepare for that possibility.
And lawmakers proposing a travel ban to and from China.
Tayo nga sa mga pamilya natin, we take precautions when there are health risks outside the home. Ganon din dapat yung ating gobyerno
So
outside our borders.
What measures can still be done to prevent the novel coronavirus spread? Health Department's Epidemiology Bureau Head, Preventive Avellino, and former Health Secretary Esperanza Cabral join us live. Thank you for joining us. I'm Pinky Webb. The World Health Organization declares a novel coronavirus outbreak as a public health emergency of international concern. This means the current outbreak is already an extraordinary event and will require a coordinated international response. Previous global emergencies include Ebola, Zika, polio, and H1N1. The death count for the novel coronavirus as of Friday morning has reached over 200, and over 9,000 cases were recorded around the world. The Philippines also confirmed its first case of the novel coronavirus. Let's go straight to the source of the story. First off, we have on the line Health Department's Epidemiology Bureau Head, Dr. Preventive Avellino. Dr. Avellino, welcome to the show, sir.
Thank you, and good morning to you and the listeners.
Okay, one confirmed case of the novel coronavirus. She's 38 years old, a female. How is she doing so far, doctor?
So far, as of yesterday, we were informed that the patient is apparently well, febrile, but with occasional cough.
Okay. Secretary Duque was saying that she's asymptomatic. I just want to understand this, doctor, because he also said that she had arrived on the 21st of January and then experienced mild cough, so went to the hospital on January 25. So how is someone asymptomatic and yet have symptoms of a mild cough? Please explain that to us, sir.
Yes. At the time that she arrived in the Philippines, she did not have, or she never had any fever. So she passed through the Bureau of Quarantine thermal scanning. Also, because of the occasional coughing, it could have been a thing that she could have been repressing her cough.
Correct.
Or has not been coughing that much. So people would have not noticed that she had that kind of condition.
But isn't that going to be the problem, Dr. Avellino? Because you have an incubation period of this virus from 2 days to 14 days. Anybody can actually come in and pass that thermal scanner and be asymptomatic when in fact you're already incubating that virus in your body.
That is true. That's why we are now looking and reviewing our algorithm to include all, because in the past we had included fever, cough, and respiratory, but then since cases have been noticed to have only sometimes cough or sometimes fever, then we are more careful this time with regards to screening people coming especially from abroad, especially China.
Opo. But I want to go back to my same point, doctor. I hope you don't mind. If it's an incubation period of 2 days to 14 days, at any point, sir, I can not exhibit any symptoms. A suspected person cannot exhibit any, then I can pass through any thermal scanner, any thermometer, any checkup with a doctor because I am still not exhibiting any symptoms, doctor. So my point is anyone can enter easily.
Yes, that is also also the reason why Bureau of Quarantine has issued already the health declaration checklist, so that any health condition that they are currently experiencing, then they can put it in, and the Bureau of Quarantine can have the assessment thoroughly if they have cough or they have reported. But then again, if the patient will not divulge the health condition, then that would be the gap or the weakness of the system.
But also, if I fill up that health card, if I'm the suspected caser and I still don't have a cough or a cold or a fever, I'm going to put an X. Have you experienced a cough? No.
Exactly.
Fever.
That's true.
So,
That's true.
Doctor, what I'm trying to say is it doesn't seem like that's foolproof, the health card nor the thermal scanner. Is there anything else that we can do to spot a person who possibly is positive with the novel coronavirus?
I think the more drastic and move is not to welcome people in the country, but then again, there would be some consequences with regards to banning a particular country or banning a particular nationality coming to the Philippines.
Yeah.
But that is being studied as well, because there are some countries who are following that kind of thinking at the moment.
Opo, because isn't our safety paramount here, Doctor? Ibig ko sabihin,
Opo.
ito ha, si health card ay hindi po foolproof. Si thermal scanner ay hindi po foolproof. Ano ho ang pwedeng, anong suggestion ngayon ng Department of Health possibly sa gobyerno para po mas paigtingin pa ang ating pagbabantay laban dito sa novel coronavirus? Meron ho ba kayo magiging suggestion sa gobyerno, sir?
What we are looking at the moment is to recommend a facility-based quarantine for all passengers coming from China. But this has to go through the proper channels still,
see.
and we will be recommending this within the day.
I see. So, parang ika-quarantine. Wala pa rin po sa purview ninyo ang pag-ban sa mga tao, hindi po Chinese, sa mga taong nanggaling sa mga bansa na nagkaroon na po ng infection ng novel coronavirus. Wala pa ho yun in the horizon?
Yung pag-ban lang ng particular nationality, you mean?
Pag-ban po ng travelers that have come?
Travelers.
Travelers
Yes.
na nanggaling sa isang bansa na affected ng novel coronavirus.
Opo. Yun nga po ang tinitignan natin ngayon na i-quarantine lahat ng travelers coming from China at to have them facility-based quarantine. So kagaya ng nangyari noon, if you recall, yung sa Ebola, na kung saan quarantine yung mga pumunta doon sa affected area ng 30 days, I think, sa isang isla. But we are not looking at an island as an option. But ilalagay sila sa isang facility para ma-observe sila for the next 14 days.
Right. Doctor, when you talk about contact tracing, this female 38-year-old who is in a government hospital, the hospital has been named, in fact, Doctor, ano po?
Opo.
San Lazaro, ano po? A lot of things, a lot of questions. Number one, how safe are the patients there now? Ito ho bang si female 38-year-old ay nasa isolation?
Yes, nasa isolation sila. May dedicated area ang San Lazaro for this particular case. Health personnel also, may dedicated health personnel. So hindi lahat ay exposed. And strict infection control is being observed in this area.
Doctor, how many are there in that isolation area?
Currently, we have, if I'm not mistaken, 2 at the moment.
But the second one is still a suspect person under investigation?
Yes, also.
Kailan ho malalaman si number 2 kung positive o hindi?
Kung positive, ang what I know of is pinadala sa Australia yung kanyang specimen yesterday, so that would take about 2 days.
I see.
Baka bukas meron na tayong result.
Doc, so yung patients and staff in the hospital in San Lazaro right now are safe. What do you want to say to those, the patients or to their families na nangangamba po ngayon?
For those na nangangamba, ang San Lazaro po ay known to be the referral hospital for infectious diseases. So equip po sila ng lahat ng measures para po maprotektahan ang ibang pasyente sa ibang infeksyon na maaari na makuha sa ospital. So, rest assured po yung ating mga pasyente sa San Lazaro, sila po ay napoprotektahan from the possible infection din na nasa ibang area of the hospital.
Would there be a suggestion from you, Doctor, na dun sa mga kailangan pumunta sa San Lazaro Hospital to possibly just choose another hospital from here on?
We don't encourage that.
Okay. Okay. I want to ask you, sir, doctor, about the contact tracing. Na-figure out na ho ba, na-trace na ho ba kung sinong kasama, saan nagpunta, si 38-year-old female positive of the novel coronavirus?
We have traced the flights that they took. We have also traced the places they've been to in Dumaguete.
Apo.
Kasi hindi na transit lang sila sa Cebu. And right now, our epidemiologists are going to the Region 7 to do the contact tracing.
Okay, I want to put that up on the screen. I think we have that, sir. Yung kanyang naging travel. January 21 was Hong Kong to Cebu. Okay. Pagkatapos po nun, this is her travel history, Hong Kong to Cebu. And then January 22 is Cebu to Dumaguete. And then I think January 25 is Dumaguete to Manila. So, na-contact trace nyo na ho lahat ito?
Yung mga lugar na laman na namin, and we have coordinated with Dumaguete. In fact, the PH of Dumaguete coordinated with us yesterday, last night to be specific. Tapos, but as early as yesterday afternoon, alam na namin yung lugar kung saan pupunta, and we have already prepared an action plan on how to go about with the contact tracing.
Is this a resort, sir?
Yes.
In Dumaguete?
Mm-hmm.
Opo. Yung sa Cebu, sir?
Wala silang pinuntahan sa Cebu. We learned it only last night that from Cebu pala, dumiretso na sila pa Dumaguete.
Dumiretso
So it was
na
like a connecting flight.
Oh, was it a connect? Hindi po nagroro. Kasi meron
Hindi nagroro.
so, connecting ka agad from Cebu to Dumaguete. Kasi nagtagal sa Dumaguete ng 22, 23, 24, 25, 4 days. Doc.
Yes.
So, ang kailangan ho talaga dito yung resort sa Dumaguete.
Sa Dumaguete.
Just very quickly, Doc, I hope you don't mind if you can answer me. What about those na nakasama sa aeroplano?
We have also received the flight manifesto. So we are looking at those that are on nearby seat doon sa pasyente. So it's the rule of 4.
Rule of 4,
so
okay.
4 at front, back, and side. So
Yung po ang kailangan. Okay, how many persons under investigation now, Doc?
Currently, we have, I think, 56, if I'm not mistaken.
I'm sorry, sir?
It's
56 persons under investigation. Doctor,
It's patient under investigation.
patients under investigation. Dr. Ferchito Avellino, Doc, thank you so much for your time, sir.
Salamat din po.
Also joining us here in the studio, former Health Secretary Esperanza Cabral. Secretary Cabral, good to see you. We want to understand the virus more. Please help us understand this. Is this something we should fear? Nakakatakot na ho ba ito?
Nakakatakot siya, pero hindi naman kailangan na magpanic tayo. We should just do what we can in order to prevent ourselves from getting the virus. And there are very many practical things we can do.
Such as?
Such as washing your hands properly and frequently. Properly, I have to emphasize that kasi hindi ko mo nilagay mo sa tubig yung kamay mo, hugas na yon. Hindi. You should really use soap and water and briskly rub your hands.
Yeah, rub it talaga. Ganun.
Yes, right.
So, yung iba ho kasi, minsan tubig lang ang ginagamit, Sec. Hindi po, that's not effective.
Yeah, wala yung magagawa sa atin. Kung walang soap and water, pwedeng alcohol-based sanitizers, pero mas mahal pa yung kaysa sa sabon.
In a day, would you say, how many times should we be washing our hands? And
If our hands are not obviously dirty, okay, we should just wash it regularly before we eat because that's the time when we're going to put something in our mouth. Okay? And then when we take a bath or when we go to the bathroom, and then we need to wash our hands
after.
After, yes.
after your business in the bathroom.
right.
We need to
Yeah.
be able to do that. And we want to talk about this. How do we actually get it? Secretary Cabral was telling me about, the difference between, droplets and what's in the air, a virus in the air and droplets, so we understand better. Actually, Secretary Cabral was saying there's a number of feet by which ikaw maaaring ma-infect. But we'll be talking about that. After the break, this is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, former Health Secretary Esperanza Cabral. Doc, nung kausap po natin kanina si Dr. Avellino, sabi niya, the patients under investigation is, 56, no? I'm a little surprised by that. It almost doubled from the last number that I know. Why is this happening?
Oh, I expect that it will go up even more because, as you said, the incubation period is 2 days to 2 weeks. So people who have been to China were able to come in, and through this period, only now are experiencing symptoms, saka lang sila pupunta sa doktor. So, dadami pa yan kasi hindi naman tayo nagpipigil ng maraming tao na pumasok dito mula dun sa areas na merong cases ng coronavirus.
So, kung kayo po ang tatanungin, panahon na ho ba para i-ban yung mga travelers na nanggaling sa mga bansa na infected ng coronavirus, novel coronavirus?
Palagay ko, dapat na natin gawin yon. Kasi nga, napakabilis ng pag-spread ng illness from coronavirus infection. Kung titignan mo yung dating SARS, it took 9 months before it could be controlled. And in that period, a little less than 10,000 people were infected. Pero ngayon, nandun na tayo sa close to 10,000 within 1 month. So, ang bilis talaga niya kumalat.
So, ang hirap po sabihin sa tao na huwag kang magpanik.
Oh,
With numbers like that?
Yeah, talagang mako-concern yung mga tao. Ang isa pang problema, hindi naman problema, ang isang situation ngayon is napakabilis ng balita na kumalat.
Hindi katulad before.
Hindi katulad dati.
Secretary, could you help us understand, paano ba namin ito makukuha? Kasi may sinasabing, ano yan, airborne yan or droplet yan? Please explain to us.
Ang ibig sabihin lang ng airborne is the virus comes out of a person infected with the virus, goes through the air. Okay, that's why it's called airborne.
How?
By coughing, by sneezing, kasi nandun siya sa respiratory system eh. So by coughing, by sneezing, mapupunta siya sa hangin, sa air. Tapos, mula dun sa air, pwede siya maglanding sa mukha mo, pwede siya maglanding sa lamesa, tapos pwede mong hawakan yung lamesa, pagkatapos yung kamay mo, ihawak mo sa mukha mo, mapupunta na uli rin sa'yo yung coronavirus.
So,
pareho rin ng maraming ibang viruses.
wala siyang pinagkaiba doon.
Walang
Ganon din po yun.
pinagkaiba. Oo.
Kaya sinasabi nila, always keep your hands clean and
Yes.
don't touch your face if your hands are dirty.
Tama, oo.
Would you say it's more effective to wash your hands than to wear a mask, or are both just as good?
You have to do both. You cannot just wash your hands and not use a mask if a mask is indicated. But right now, a mask is not indicated in many instances. Like ngayon, dito sa studio, hindi naman natin kailangang mag-mask kasi wala namang taong pumasok dito na may coronavirus.
But we don't know that.
Well, I think that we can be fairly sure na wala.
But it takes 2 days to 14 days. Hindi ho ba may incubation
Oo, alam mo
period?
naman kung sino yung pumapasok dito. Pero kung ikaw ay nasa mall,
Apo.
yun talaga, hindi mo alam kung sino yung mga tao na nandun, kung nanggaling ba sila sa China at may dala-dala ba silang coronavirus.
But I guess what I'm trying to say, Secretary, right now is hindi na po sapat yung sabihin natin galing China.
Hindi, kasi marami ng ibang lugar na
Exactly.
merong coronavirus.
So, pwedeng galing po from, let's say, China, nandun po sa eroplano, may kasama pong Pilipino.
Ay, oo.
O, edi pwede nang na-infect si
Pwede.
Pilipino at
Oo,
dinala na dito.
pwede.
So,
Pwede talaga.
those are the things that could be
Yes.
done. So, protect yourselves by wearing a mask and definitely washing your hands. There is one that I read through text. It's supposed to be a Chinese pulmonologist. Ang sabi daw niya, I don't know if you would agree, gargle with water
Yes.
and salt. Is that true or not? Because it kills though the virus in the pharynx.
Yes.
Okay.
Yes. I don't know whether that is true or not because there is no study yet on that. But really, pagka meron ka namang sore throat, gusto mo naman talaga na inom ng inom kasi ang feeling mo very dry yung throat mo
Yes.
di ba? Pero the virus, if you already have it, it will take its course. Nandun na yun di ba? So, kung magkakasakit ka dun sa virus na yun, magkakasakit ka.
Okay.
Oo.
So, hindi po totoo yung moisture, you need to keep drinking water to put moisture in your throat because a dry throat, virus thrives in a dry throat?
I don't think so. I think it will infect you whether your throat is moist
Really?
or dry.
So you don't believe that. Yung sinabi ko po, Secretary, yung gargle daw with water and salt.
Again, it gives you a soothing feeling, pero there is no scientific evidence that says na it will prevent you from getting coronavirus. Use your mask and wash your hands.
Okay, very good. Use your mask, wash your hands. What about vitamins?
Ganon din yun. Hindi rin proven na meron siyang epekto tungkol sa coronavirus or any other kind of virus. It supposedly improves your resistance against certain infections. No? And there's really no harm in taking vitamin C. Anyway, it's water-soluble. Pagka sumobra na sa katawan mo, iihi mo lang yun.
You don't OD. On vitamin C, as they say. I want to
Yes,
talk about the difference, Secretary, between the flu, the typical flu, and the novel coronavirus. How can we spot? Can we actually spot that? We'll be taking a short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, former Health Secretary Esperanza Cabral. As former Health Secretary, please tell us how far should the DOH go in terms of giving us information about a person who is positive of the novel coronavirus? Should the hospital be identified and any other factors?
I don't think that it is relevant where the patient is. Okay? But I think that the DOH should announce that there is a case like that in a certain area, like certain city. But for the privacy of the patient, that's really all that you can say. The gender of the patient, the age of the patient maybe, but you cannot identify the patient.
Right. The patient has not been identified, but the hospital was identified.
Yes, you can do that too. There is really nothing to hide where the patient is.
You know, and it's hard to hide that. I think that everyone in that hospital
yung
will start...
mga ibang ospital, wala ngang coronavirus sinasabi na meron.
Right. Remember the one in Muntinlupa, an Asian?
Hindi lang. Makati Medical Center, Asian, lahat sila nagsasabi na meron. Wala naman.
Yeah. That's why it's important for the Department of Health to have that press conference every day also to debunk.
Which is, that's a good thing that they're doing.
They're doing right now.
Yes.
Okay. Is there anything else they should do? Any suggestion?
For now, just keep at the information program and also the education as to how to prevent. Kasi hindi kaya ng DOH na i-control ito nang hindi tumutulong ang komunidad, ang tao. We all have to do our parts. Pag sinabi sa atin na huwag kayo masyadong pumunta sa crowded places para hindi kayo magkasakit, huwag na nga tayong pumunta. So, all unnecessary trips, huwag na muna natin gawin.
Right. Okay, so while Secretary Cabral is here, we're gonna do how to wear the mask. This is the surgical mask, of course. Oh, may ano pa siya. I'm gonna ask Secretary Cabral too. You know why, Secretary? Kasi meron siyang dalawang I know you're supposed to hold it here. Meron siyang dalawang blue and white. Sabi nila, kailangan pag may sakit ka daw, yung blue na nasa labas. Kapag ano daw, baliktad. Is there such a thing?
No, it doesn't really matter.
It doesn't matter.
It
Okay.
doesn't matter.
So, should I wear it or yeah?
Yeah.
Okay.
You can put it that way. Now, this one needs to be under your chin. And this one, meron itong bakal dito. Kailangan i-press mo na ganon para ma-tight siya. Ganyan. Okay na yan.
Okay. And this will help me from any virus.
Yes, so not just coronavirus, but any type of dust or bacteria, germs like that. It will help reduce your exposure. It is not 100% perfect kasi makikita mo may mga butas naman siyang ganyan. Dito pwede pa rin pumasok yung hangin, but it is better than hindi.
Yeah. At least you're maybe 90% protecting yourself.
Yes, about that much.
And Secretary, what about the N95? When is it time to use this?
Usually, sasabihin namin na pag nasa ospital ka at saka talagang may expose ka dun sa pasyente na may virus na gusto mong iwasan, yan ang gagamitin mo. This one is a bit more effective than the surgical mask sa pagpigil na yung virus pumasok sa ilong o sa sa bibig mo.
Because it's
ang filter niya is much more effective. Mas maliliit ang butas kesa dito.
kaya mas uncomfortable siya, no?
Ang hirap
Secretary?
huminga sa N95 mask kumpara sa surgical mask.
When is it time to use this for us? Like when I go to a hospital, let's say sabihin po natin, San Lazaro, pupunta po ako. Should I wear this or should I wear the surgical mask?
You can wear the N95
So pag
if you
alam mo
want
ng area na.
extra protection.
Okay.
Yeah.
Hindi naman po OA yun.
Hindi naman.
Just as a last question, Secretary Cabral was telling me a while ago, it takes how many feet before you can actually get infected with somebody with a novel
They
coronavirus?
say mga 6 feet or 2 meters. This is the reason why yung rule of 4 na sinasabi ni Chito kanina, 4 seats behind, 4 seats in front, and 4 seats at the sides.
So yun ang perimeter mo.
Oo.
So you're looking at what, 6 feet more or less
Yes,
before
right.
you can be infected by
6
the
feet na radius.
novel coronavirus. Are we expecting this to get worse? I mean, more infections?
Palagay ko, it needs to come to a point na wala nang mapuntahan yung virus bago siya mapigil na, mawala na siya.
And with the WHO declaring it already as a global concern, what can we expect?
We can expect more countries to put up more stringent restrictions as far as travel. We can expect these countries to ramp up their education and information programs. We can expect them to ready their facilities to receive people who are suspected of having the virus or who actually have the virus.
All right. Former Health Secretary Dr. Esperanza Cabral, so good to see you.
Good to see you too. Thank you, Pinky.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.